Before we get to it, I think we should give a big round of applause to Sandy and Anne-Louise for making this symposium happen, because I think it's really important. Today actually marks a special anniversary for me. Actually, 5 years ago tomorrow, I went under the knife getting an operation called the Whipple. It's just about the toughest surgery you can have. I bet most of the people in the audience know about it. Mine lasted 6.5 hours, and Dr. Gallinger, who's in the audience and will speak to you later, took a quarter of my pancreas, half my stomach, a bunch of small bowel, and pieced it all together. And when I say took, I mean that literally. Those nasty bits are in the lab and in some very unfortunate mice. Good news is, all I remember about that night is that the drugs were very good. So it sounds like quite an ordeal, and it was. But the fact was that I was very, very lucky to be able to receive that surgery. And only 15 to 20% of pancreatic cancer patients are eligible for the surgery, and that surgery really still is the only hope for a cure. The fact is that most people are diagnosed by the time they're diagnosed. It's too late, and it looked like it was going to be too late for me as well. But if you can imagine such a thing, the reason that I got so lucky was that I had already had breast cancer before. And that's why the doctors knew enough about me to give me the individualized treatment that saved my life. So the story basically starts with my late mother. She had breast cancer in the early 60s. Her treatment was successful, and she ultimately lived another 30 years until she died of ovarian cancer. That was actually 20 years ago this month, and it was a little more than a year before the discovery of the so-called breast cancer genes, the BRCA mutations. I have to say that none of that twigged for me, and it wasn't until I had already been diagnosed with breast cancer, and it was actually the day before my lumpectomy that I found out that I too carried the BRCA2 mutation. Now, if I had got that news today, they would have used that information to tailor a treatment for me. But back then, and it was only 7.5 years ago, I got the standard treatment. The only difference was that I was offered the option of having a preventive double mastectomy because you can get another cancer, which I did not do. After my treatment, I had a lot of genetic counseling, I had my ovaries removed, and I got a very, very heavy screening schedule for all kinds of things, including melanoma. A doctor would go over me with a mining light every 6 months. I don't even have moles. So I was in the hospital a lot, but nobody ever said anything about my pancreas. So fast forward 2 years later, and after feeling sick for a few months, I finally was diagnosed in emergency. And a couple of days after that, I ended up in Dr. Gallinger's office. And he already knew that I had the BRCA2 gene, and he actually wondered why I hadn't been screened, but nobody told me to be screened. And he also knew, they just come back, I think, from ASCO, that there was a new class of drugs that target the BRCA mutation. Unfortunately, they were experimental. I wasn't eligible for it. So they put their heads together and they decided to try an old drug, which they thought would work in much the same way. And by the way, that really doesn't do justice to the kind of creative thinking and innovation that went into that decision, because I was the first person with a BRCA mutation that was treated that way, and the drug that I took had been used before on pancreatic cancer patients and basically didn't work. So they decided to try to shrink my tumor so I could have the surgery, and it was a good thing that nobody at the time told me that basically that never works. So I've never been as sick as I was on my first cycle of a drug called cisplatin. But when I was scanned again 2 months later, I was extremely pleasantly surprised. Not as surprised as the doctors were. It worked. My tumor shrank by 50%. It moved away from the veins and the arteries. And it went from stage 3 to stage 2. And Dr. Gallinger told me that he had never seen that in 20 years of practice. So I had the surgery I told you about, and 5 years later, I'm as healthy as I've ever been. Thank you. That is the promise of personalized medicine. Only when it comes to pancreatic cancer, it's not quite that simple, because our next speaker has found 2,000 genes associated with pancreatic cancer. So Professor Andrew Biankin is the director of the Wolfson Wall Cancer Research Center and the Regis Chair of Surgery in the College of Medical, Veterinary and Life Sciences at the University of Glasgow. Before that, he was the head of the Pancreatic Cancer Research Group at the University of New South Wales in Sydney, Australia. And he is here to tell us about the latest advances in personalized medicine.